يقولوا له مال لونيليتي أسيلس مرة بدول مرة كلاي مرة بقول بلاو بيلون إبر كلاي مرة مسيل بلاو President of Senate مرة بقول senators Speaker Anastasia مرة بقول delegates governors legislators ministers مرة أدلا Ministry of Health Incident Commander Udoy Mr. Erbelau Dr. Hancock Dr. Cash and Dr. Yano mal asu sergid mar other bela rogul ngara lodeng sergid rel al sils ngara ayang mor hochari gi mangara ikra blur bela tuta mnari ko gigrel bekal mandem lo ngara a worshipper obvi sergid rangarul muth. And you know one of the amno topic ngal pastor jana am sadra Moses mangara Israel يعني إسرائيل إسرائيل تبدر إيجيبت عندهم لقى ستوبل كامبلين دكتوريانو نمر نرى البنغلير ميادي مرا منداي دي كده مدينة سينغاريا منداي ينغاري عدقت مال understand درسل السبق رينغر أدرابلو من كلو توتريلا أدبرا أبواي يقمان مرينغا سوليلا ميديال ارتيال سبيشال البريس كونفرنس المسؤولين عرتيام لكلو توتريلا هيجل مرال انفورميشن البلغ تقل مرة أضرابلو ملغ كلو الراورين نقطروا له يجي عملهم دنير سرا أوني مليوريور الواسي ناريا تيرول هذا المرسل فلايت را قام المي الرسل را تل نمرق الساندي الملي بازيتيف لغا تمرسل 5 داي تست غدم تيجتير وغدا ملير هيجل فيريفيكيشن مثلا الميدنايت را Friday غدا ملو ايس رابلو لو غدا ملا فيريفاي through an antigen and a PCR test واسي مرال positive I got imported cases يلتبلو ديريغل over the weekend هذا EOC ما Ministry of Health سيل دم قدرين saying contact tracing أو المول مول تريجر روغول بلا contact tracer تير اللو يمتى والاد بلودو دنيل واسي تنيجاتيف روغوي ديغا تارتير الملا بوزيتيف تدي ملا نيجاتيف روغوي قديل واسين بتوغا information امرانا بلو ندي جاي كده correct the information so we'll make sure other بلو اقلوا other and واسي there's no other cases at this time mal دي جاي the imported case دي سيلون الايسر سيا تياجيد اغطرول تريجر تيرول cases amlera nura blur bela lega Guam flight meaning they're required to be vaccinated so tamle vaccinated and they were asymptomatic that means dimlaga nidil part dimlaga ngara fileni malubang gora arakt el causer term wala semarina ptrir ngara ayel symptoms ra covid dimla أقول قد أنا مدرسة تبع كوفيد كده من التست كتير ما قدروا قد مثلا فاكسين أو ميلا وريور الرولا آدم دخل سان مسمار ما لو بندخل في الرأسير يا أميرون قد مثلا testing system رجيت وريور قد من مدة إمرتير so عمل أكشن hospital beside the contact tracing عم تريجل تيرول الباسيبل عم تريجل التست البوزيتيف عمل مسيب الhospital نارسل تبسي يجي ذا ديريغل الملاسكر تريجل لذا كونتاكت تريسر تيلو هسه مارا خوانتين ديريغل تبسي كذا اوف كورس ان هذا القطر الاول ان هذا سلب اقرا اضربلو ملغلو بري دايركت من ايجا بريكوشنز بلا لون مالا بيجا اوريل بلا رولا مينستري اوف هيلث ريد مال مرغا سوليا ستاف را مينستري اوف هيلث اند هيومن سيرفيسز مال نمرين لورا الويكند الغوت مقلا جاي جدا الرغون مرة عليا مقلو توتلن إلى السيلس مريا سليد الغرتيان سيرا فرايداي ملنا تلذ الموضوع دورا دكتور هانكوك فيا زوم سيد التايم قدم له ترغ كليل واسي مقلو توتلن هذا Drutulo mesagel uk tertera testing ri da tiblol nga sa ek. Kada tilbil wase trigel mlera kasus amo testrel al tutaw. Malas mal morsel wase kada tester tir airport sel lagel. Le other ngaram rigel me 72 hours lu eta test emu masa skogi. So mal ngoder sel uk system rigel Taiwan al tangar airport te test ru nga sa skogi mung Ndiak seguida la simla seta mol norger meger te test sel nga sa skogi tial uk kwama nga 72 hours ru e. Mung neurtur seguida ma recommendation ma da seguida makalaurio ase brod increase seguida el testing. Seguida el meeting adregal noria tele de modo adram rigel modo mal bringa sule adram rigel ambassador Hennessy Island and no sabe el laurio lom tira adra CDC maula Dr. Henkaga ma Dr. Cash amo si il merbelara kasus yang artiale rule Sunday lo no sera gider rogui artiagi el pandemic ma igel uldas wase ngara igel ungil el tretar aurol dol tirakle yar adre bela selba kada mringa sule la government trambrigel matrigal terur tohtan uknos il join gider al sils. I'm going to speak in English because I was told that last press conference there was no opportunity for the English speakers to know what was said. But first of all, we had on Friday evening, 2 of the passengers that arrived on the Guam flight tested positive on an antigen test. After that, Ministry of Health calls are to do additional tests with PCR to verify if they are correct. At midnight on Friday night, it was determined that they were verified that the 2 cases are imported cases and they were positive. Immediately, earlier in the evening, the 2 cases were brought to the hospital. They were put into isolation and have remained in isolation. They will be in isolation for 10 days. Their contacts have been contacted, have been tested, and found to all be negative. 24 contacts have been contacted and tested negative. We appreciate all the efforts over the weekend for the EOC and the Ministry of Health and Human Services staff in testing and contact tracing and getting all this work done over the weekend to make sure that we're protected. During our phone call on Friday night with Dr. Hancock, we discussed measures that we need to take maybe to enhance our protection. And I think one of the things that was determined early on was adding an extra level of testing. So all passengers that were coming in on the previous week were only tested on day 5. Now, on this flight that just arrived last night, the passengers were tested this morning, so the day after. And we're hoping in the future that we will test them at the airport upon arrival. That's the next level. We just have to get the logistics worked out at the airport, but that's the plan. On Friday evening, we also had an opportunity to contact Ambassador Hennessy Neeland and let him know of the situation and our request for help, for experts to come and help us, to guide us and give us good advice on how to best mitigate against the challenges with the COVID and the Delta variant. So at that time, our request went to the U.S. Ambassador. He worked with CDC, and on Saturday morning, he let us know that Dr. Hancock and Dr. Cash would be coming to Palau for 2 weeks to help us through this process and give us advice, best practices, and just help us understand COVID better. And so we really appreciate the assistance of the U.S. government and for the 2 doctors to be here with us today. We just came from a meeting with Palau's leadership and had the opportunity for open question and answers. And I think this afternoon our goal is to be able to discuss with the media openly questions about the people's concerns in the public, especially on should schools be open, should we continue life as normal. Those are things that we want to discuss and make it clear what our direction is. So a simple answer is yes, schools stay open. Everything stays as normal. We should follow those best practices like wearing a mask, washing our hands, social distancing. Those are good things to do. Doesn't matter what kind of variant you have. Those are good things to do to help prevent the spread of COVID and keep us safe. But most importantly, get vaccinated if you haven't. Maloise, iba'y kung telteal والمساء قفار مبول بس كده update الجيرة تيال الكوفيد هذيك ترى ترجال من الدين رجيد من بلور أمريكا لا help رجيد لو مس كده otherwise يدير الغرا أو نسير رجيد لا يجل كوني لورو لا يجل بيبي رابلو لا أسأل help الشباب كليدر تيال تقرا كوفيد يدير الغرا أي سجيد رأسه مرا يجل دكتورة هكاسة مرا يجل لونيل دول تيراكل الثلاثة أورول جدا أمرور أسبق ترى أدر بلا ويسي دي بوقتو يجي ده قولي تراغ فارم البول بس كده update
Sulang Mr. President malungil tasil sa mga beklat. Aktil mo to kamo to elabebira details sa gel tablol case again hindi ka at time hindi ka tu madingil lasing ngariya tokol el ice el marara social media lo setam lamot tewang em lamot telol me te with 10 so sa mga clear sa el at time mandir ka tigil tablol case tamalmol mga isolation kung nasa namo sa edalo ay so setir ka other belaw ta other belaw mlara merigel el may nasa igid el flight imol dadil ma imol saal ta malmutal al time and ta asymptomatic bulgulak mundia ka kora ulang alelarak tan ngartir ta infected malmol malngara isolation or hospital sa igid dila president 10 days president tamlo dula o 24 initially mlaringa 24 close contacts sa tirgay del positive case el mildang eli melang arian muteteru mung till 26 am la test negative mutel me test ra day 3 ma day 10 so agi le issue tira quarantine order et mutel mo test tira day 3 ma day 10 tirgel terul positive case ngara isolation el 10 days sa test tira day 10. Okay, close contact mabulgulak mo other surveillance sa Ministry of Health and Human Services milingit mo ra investigation al interview tikal positive case loger tira tokol badingila ager luldimuk ringi ager lo se kom larger tawat al ada misal qura man lukme that tiril within 6 feet kasingilang at least 15 minutes kung kakaru sa criteria al ada mo umatang at mong close contact masayagid amle result sayagid initial contact tracing investigation tigid 26 mga nangatangat taling so far at negative hindi again malmol naman ni tortir mutul mo test tira day 3 ma aday 10 mong suwadal kora din mutul maklat ka adra balul wasel sugum hindi ka umakadong orkaw ak madingel se kada turkok kal madan tirigal at tokar adril detail laway sama kada malas mga lakran ng dir adra balul wasel sugum diri ka kamwa ating water other hospital wasel ka loam lek med tigalat ing ahmal gi kadet elem le close contact tin hindi swadalo o ay sa adra balul wasel uriyo ramalmol hindi ka dilbor se stop kada malmol lo mesa ra situation malmol mga mok ra contact tracing at sugum diri nganiar made el adal el tira amlok med tigal positive case direct kalswadal makataklis el tokora testing beto ka question el girela tegid el delta variant tamsal makatakilo sa gel test el labar el all time ra hospital ma clinic ra doktoriano asabel dong ingal raktel gal armela covid-19 gel SARS-CoV-2 virus hindi sel mo malang alwaseng gangaral variant gireda lol durok ra specimen el moralab ngara ablura marigel masay direct kal gimot mo kuri lurior gi malas manul durok la gel sample arterial terul positive case el mamaraya adurstel ngarsel APA flight mong tangat lang artiang Dr. Hancock direkal sa el gora musugi der segi del process el durok laigel mora abalura merigel el mora sequencing el mo omes ring lo sing mal ngaral al variant hindi el at time kada madingil lo sing positive case kita mangira result sa segi del sequencing direkal so adalo ay sara adara balul wase segi el plan el bleda announce ringira last press conference el wasing ania mitigation plan el bled endorse ringa NEC segi di adul tu ringira tokoira community mitigation mong botoka question el gire la school magire la siobay ma aureol wasing malamol malubendia botoka gel gire la amaklol gor ondib ma kamaldil mong swada lo ay sara adara balul wasing ani segi del plan el endorser nga NEC el alwi kagi mo geko kumamel lo tob dringi o lisakar adara balul senseng mal nga balgul o sel sugo mong lengelak tela el gays al sela balum la kana mo rangal stage al sugo mong require alaktaw ni ngoy ngrang yegita ko ra details nga al sel segi del mitigation plan di close to tela todo el time masero egel baldu president kada malmol ngara amrula gel dorul hindi kita di mo korigik bay direkal so man ngutalte ale mal mereng sulir adrablu lengwal di braka ka meirel top de la sempre como mask igitel ngar se tel yo mask rogui ada por abevira shoba di film la otob da tigingi lo se o vera ablima mingiri lo mask mal ungiri makarang igi dia dobrega sulir adrablu gireleng wal dilgi del teg initiative el mga la preventive measures hindi sa igi adult tirak sa igi del mitigation plan yung wal dia ka a mandate tra Ministry of Health and Human Services el at time el mandate anything beyond regel ngaring el at time hindi again dia ka tomera shoba el sumguk tingil so al implement el sorry implement the preventive measures mong sa igi da ko tetele la moving forward el wasega da mo omes segi del mitigation plan direct el albla lut el reactivate IOC agi mo gil amol top da daily mutel mo daily cell situation report mandial dil bekkel sunday mo bekkel sil sa el top da ko updates el mara media mar adra blu unda segi kita ngil updates for now by real mo questions
Become summarization to ramriya.
So just adding more details to what has been said about the 2 positive cases. So again, we remain with only 2 positive cases right now in Palau. These 2 cases are both Palauan citizens, 1 male, 1 female. Both traveled from the U.S. Via Guam on the August 15 flight. And they were tested positive on their day 5 test on August 20, and as the president said, they were confirmed that evening. Initial close contact revealed contact tracing revealed 24 close contacts to both cases. They have since tested negative, and they're placed under quarantine for 10 days, with further testing on day 3 and day 10. Today, there were 2 additional close contacts identified, so they too are mandated the same quarantine orders and will be tested on day 3 and day 10. So far, the 2 positive cases remain asymptomatic. They will remain in isolation at the hospital for 10 days with a test on day 10. Again, we want to reiterate that contact tracing is ongoing. And if you have not received a call from our surveillance team, then there's very little possibility that you are close contact. So we know that there's a lot of concern in the community that people might have seen the positive cases. I'm pretty sure some people already know who they are through their relatives. So again, we have to we ask for cooperation and patience, and let our surveillance team continue with its contact tracing work. Another initiative that we will be looking at and working on this week moving forward is the community mitigation plan for COVID, which was endorsed on Friday, well, I would say Saturday morning, by NEC, and that plan really spells out what mitigation measures are required at what stage of infection or community transmission if we come to that. So that's one of the activities that EOC and NEC will be working on this week and next week. I think I also failed to mention the school mitigation plan, which is ongoing work with a work group that includes Ministry of Education and private schools, principals, and Belao Head Start. So we know that the unvaccinated are those under 12. So that plan will start focusing primarily on the kinder to 8th grade, on that age group, and really looking at how we can keep schools open, but at the same time make sure that we put mitigation measures in place to reduce the possibility of COVID transmission if it comes to that point. So those are some of the ongoing activities, and we're thankful that Dr. Thane Hancock and Haley Cash are both here for 2 weeks, and we'll be sure to utilize their expertise and advice when we engage with our partners from the Ministry of Education and others in doing these plans. So that's sort of a work plan moving forward while we continue to monitor the situation with the positive cases. We will also reinstate the daily situation reports to the media and to the public via we have an email listserv as well as a Ministry of Health and Human Services website, and numerous profiles on various social media channels. So we'll disseminate those daily situation report and then press releases as they are issued.
Oh.
Yes, just want to also remind that there is vaccination on Friday at the National Gym Pod. So any remaining 12-year-old and older who have not received the vaccine, please come to the pod on Friday. 2 p.m. to 6 p.m. is operating hours for the pod on Friday. So again, any remaining 12 and older who have not received the COVID-19 vaccine, please come to the National Gym Pod on this Friday, 2 p.m. to 6 p.m.
Edik waktali gafal wase tial the face ringir al seals langalay tablol positive case is what we've been planning for. Mlamo 18 months era the sisabra COVID. Kadamral mrenga sula la Ministry of Health and Human Services ma timel tira gotem le blagaran direl first that masaba akri umlemring la quarantine, and then umlemring la oral vaccinated to get us prepared. Back in March asral misel timra HHS at kadamlat magase ilang giria del masamo crowd the Sweden mom da say namoda kadangara namoda giria dam dasra COVID free kadam dasra COVID safe. Mong Dr. Hancock ira ite ang artikel bangget maybe helpful artikel discussion ma direct opportunity na media logera agir. So I just wanted to say that first of all we've got to be thankful for the tremendous effort by the Ministry of Health and Human Services and the EOC team to keep Palau COVID-free for a very long time by implementing quarantine measures that have kept Palau safe. And then launching an aggressive vaccine campaign, which has ended up being the most successful vaccination campaign of any country in the world to date, with vaccination of the total population exceeding 80%. So back in March, when the team from HHS was here and we had meetings, I think one of the things that we talked about was preparing for this day, that when we have to transition from being COVID-free to COVID safe. And that means when the people come and they have COVID, we contain it, we protect it, and keep the people protected. And I think that's where we are. So that's why we continue to go to school. The flights continue. But what do we do to mitigate and make sure that we're safe? Masaya ulo kada malmol mal mora school, marul ay gero ul gira dan marul, mas kogi dir kami, hindi kada masa sengaray gel baby rasa dan marul, ulso bak clear mo kada klagar. Jadi lungi la baik ulan un sa ira ite Dr. Yano, ma Dr. Hancock, ukla boldu say and then maybe we could more question and answer. So Dr. Hancock, Dr. Yano, I give you the floor to begin this next phase of discussion, and then maybe after that we open up for questions and answers.
Okay. Thank you, Mr. President, and thank you to inviting me, allowing me to come and continue the collaboration with Palau. It's really an honor to be here and work alongside with your team. This pandemic is certainly a historic time, and I think it really has demonstrated the strong and enduring partnership between the U.S. government and Palau, and for me to be able to come and help work with your team is a continuation of that. And I have to say, Palau is really amazing, just a global leader in taking on the pandemic, utilizing the vaccines to really create a layer of protection that is unprecedented in the world. And so I think, as you move forward from when you first, prevented introduction, and then Palau came up with the Palau model for getting people into COVID-free areas in a safe way, and then really performing and carrying out a vaccination campaign that is amazing in its ability to prevent or help prevent COVID-19. Throughout all of that, all of those things that you did and everything that is being done in the globe is really in response to COVID-19's ability to really cause severe illness in some people, can cause hospitalizations and can cause a lot of hospitalizations that overrun the hospital capacity, and unfortunately can cause death. And that's why throughout the world, countries have struggled with how to respond to this. And I believe, Palau is way ahead any other country at being protected from COVID-19 and the effects of the virus that we really worry about, which is that severe illness, hospitalization, and death, because you have put in place what CDC feels is the foundation of really addressing COVID-19, and that is good vaccination coverage with appropriate vaccines. And Palau has done that. And so your first major layer of protection against COVID-19 is there. And we know that the individuals that are at highest risk of that severe illness are people that are older, people with comorbidities, and those people have generally been vaccinated in Palau. So that's fantastic. And then I think as the Ministry of Health adapts their approach to the changes that are occurring in the pandemic, especially things occurring outside, I think they're doing a great job of adding additional layers of protection. And of course, one that's been there is sort of your entry process, and your systems were in place to try to identify COVID-19 when it was introduced to Palau. And these two cases, I know they may cause some anxiety to the community. They're actually a demonstration that these systems are working and that you identified those cases and your team has been able to isolate them and do contact tracing. Now, so I think there's certainly things that the Ministry of Health looking at schools. I think you may have seen in the U.S. we found that schools are really important to keep open for the kids. And in this current setting in Palau, where with just two travel cases, you definitely would want to keep schools open, but also down the road, and the ministry is already well ahead, thinking about what are those additional layers of protection that can be put in place to help protect those children as well. And so I appreciate the opportunity to be here and collaborate with your team. And also, I think you folks know that, our support with vaccines and, other treatment modalities that help prevent hospitalization. It's really fantastic that we have that close connection and are able to help provide that to you folks, and then seeing just how fantastic Palau has done at protecting itself during this time. So thank you for the opportunity to be here, and yeah, I'm looking forward to the future collaboration with your team.
So long Blas, the last mole mga deba igel dal mo igel maklol gora dai ratigingel mong laseng nga ka Aurora Guam lo relevant adra CDC lo nga sa igel blura Associated Pacific Islands mal mrenga sulela qabelment bela ma president el show taringil May من سبيل لبنجلا team MOH Minister of Health ma Human Services lo masertir tal response ligera egal tablo case mung klde moktegra ayobo girelo el kabay egel mringil ser egel duk mun severe illness ngol gabay amon New England Hospital yol gabay ser el sibed el mosme el madringi mung seyidia wal gotel level sel wal gotel blabel urered el tomer tal ser seyid el lurior amalungil al sugumar bek lad mal uben betok ladra blu amla mayo bortir seguidi agot el protection. Ongerung ay galdo saad el melgo tiging la mask ma meeting lo material betok laad ma meeting lo ngaral sila blay ma school mung makarae ekado sigal do ulel ekado mga sadar tial ser mandiakal mo yul. Igal tablol ser am lel o giwa omrael. Dimlak el ser el dilub rablu. Mlar omrael may. Mang mlaset igel reol blam rule ra Ministry of Health el malang el tirgal adro omrael o reor. Hindi miltigringik mlaseng tara amosibi rulia di merda ada bolguguk etamalang ringin diakal ilil mo ngayim ludor ubangayim klubse ruri tadong ira kotel sils el mutel malang ringir ngayim ludor le selbodo ngay ekadmom ngek laseng kadmagarang magdmo selba akla mang malmol mo laseng a school aguk mongod atletelel ending ngartial rules ande mang mamalas mluro lo bentrier wakafar el mrul aigel plans aigel dorul el mangsader tial ser mandial lolmol malubeng ngomer karablu President dito Isaac mo EOC lilut al-activatoringi. President mong sera al-activatoringi arwa ka faram lamurior mong tirgagi del weekend tulurior mong kamasulang ar segi del activation President.
Namaste lo que era que Malungil itasil si President ma Dr. Yano, Dr. Hancock, Marbekla. Akari ka tablong mo kaya bebila atikan ya karir. The first question that I have is to Dr. Hancock. We of course he says we don't know yet. We don't have the capacity here to identify whether it is a Delta variant or other variants. And the process of testing has been changed, so it's now going to be when they arrive the day after they will get the test, and then another in 5 days. So for the Delta variant, how long is the incubation period? And are these testing really going to show us anything once it's been done? And also we heard from Guam that there's a growing number of people that have been infected. They also they're vaccinated, but they've been infected. They've been hospitalized. What's happening in Guam that's we can learn from and probably help prevent that from happening here? That would be my question to you. And then my second question is really to the President. You know, the concern that's you hear in the public and possibly been disclosed to you is people want to know if this is coming through Guam, why won't we close that access and fix and resolve this issue locally, or is this the new normal? And that we should be continuing it while we put in place mitigation measures. So what is your, what's the thinking behind the policy? So those are just the two questions.
Okay, thank you. Yeah, really great questions. So the first one regarding the testing, we won't know for sure. We won't be able to confirm the testing of these first two positives as far as the sequencing results that would tell you what type of variant it is. We'll be sending those off for that confirmatory testing, and that result will arrive later. Despite that, waiting for the testing, just because of the patterns of transmission outside, both in Guam as well as the rest of the U.S. and globally, is really dominated by Delta variant. And so the Ministry of Health is moving forward and acting like, hey, this is probably Delta variant, so we want to respond as you would if it was Delta variant, and then would find out later, but automatically just sort of responding to it like it's Delta variant. The question about Delta variant incubation period. So one thing we found about the incubation period is the time from somebody's exposed to the infection to the time that they actually start developing symptoms. Also in there is the time from when somebody's exposed to when you can actually do a test on them and they're positive. Because as you can imagine, you may get exposed to just a few number of viral particles and they start growing in you, and it takes a while before the virus has grown enough before the test can identify it. What we found with Delta variant is that time for the virus to grow is quite a bit faster than the other variants, meaning the median time, so the time that was sort of in the middle of when people would have symptoms for the old variants was about 5 days. They're finding that for Delta variant, it's more around 3 days. And what that means is people get exposed and the virus grows much faster in them, and they can be infectious earlier to spread it. But it also means you can test them earlier and get a positive test earlier. So it may sort of help with identifying the virus earlier as well. And my understanding is because of that information after our discussion, that was one of the reasons why the Ministry of Health said, hey, let's add another test to that screening process, because we know that the Delta variant is going to come up positive sooner. Your next question as far as Guam lessons. I think one of the big lessons from Guam and the rest of the U.S. is that Delta variant is amazing at finding and infecting unvaccinated individuals, especially adults. And when we look at both Hawaii and Guam that didn't have the coverage rates that Palau does, but had fairly good coverage, the unvaccinated community is really lots of spread there. The individuals that are unvaccinated and in the hospital outnumber the vaccinated 9 to 1. So it's like 90% of the people in the hospital are unvaccinated. And because of that, the Guam governor has actually said, hey, this is a pandemic of our unvaccinated in Guam. And they've put in some recent sort of requirements for people who are not vaccinated, that they have limited restriction of movement. And that's where, again, I think Palau has really maximized that protection that vaccination provides to your community against those most important aspects of the disease: severe illness, hospitalization, and death. And while no vaccine is 100%, so that's why, when you have a lot of transmission from unvaccinated people, there's going to be some spillover where you're going to have some vaccinated people that may get sick from COVID-19, and we're seeing that. But for Palau, the fact that you have such good coverage, that really reduces the main thing we're worried about COVID-19, which is not really transmission. We're worried about transmission because of that severe illness, hospitalization, and death. That is what the vaccine really reduces. By about the vaccines are as good. They're finding they're as good against Delta variant really as the other variants for preventing that severe illness, hospitalization, and death. So while there is maybe a little more transmission with the Delta variant because of, we're talking about the incubation period, it's still, the vaccine are still exceptional at preventing severe illness due to COVID, which is really our main concern. And so, in our, like I mentioned, in that whole response for COVID-19, the primary foundation of any response is good vaccination of your community with a great vaccine, which are the vaccines that you receive from the U.S., and you guys have obtained that good coverage. So you have that huge foundation there that really helps keep Palau COVID safe, even in this sort of changing situation at the moment.
Second question.
Okay.
You want me to repeat it?
Dede,
Oh, okay.
anuq the molid sel tingin ngal tora belaw. Okay, come on, Lucille Mongin. Di gotrule kida wayir ktilum. Kudul mura process rigid. El vaccinate ra adra blur bela tiaul mura January. I remember and the election Kafar, and that was probably the first time I had an opportunity to meet Dr. Hancock on Zoom and Dr. Cash when we were talking about vaccines coming to Palau back in November of last year, and trying to find ways to make sure we could get them all here and get people vaccinated. And I think at that time the thinking was, as soon as everybody is vaccinated, life is back to normal. Unfortunately, that's not the reality. We've had to adjust, and we still have restrictions because life is not completely back to normal because you want to keep people safe. But we know that we have to continue living. We have to continue making sure that people that are ill and need medical treatment can go get medical treatment. We have cases of people here in Palau that have waited for medical treatment for 8 months and did not have the opportunity, and now we've lost them. That because they could not leave. So having flights available is also a medical emergency to making sure that those people can get the treatment they need. It's also bringing families together, students to school, and getting people jobs that they need. Because some people need jobs to survive. Other people maybe not, but some people, I think a majority of the people need jobs. So kita ulmura tial nombre raga November tial uldaso mamalay gal vaccine me uldaso sel time la se ndi me gal vaccinate adam nam gadalamo ni mokl mrula gal so ndi gadam tigeringil va se auri ura gal namotel albuil ndi gada sal mor seyid kadam la vaccinate ndi gadam molmal el gargik lendi gal so dal me araq te lo prid en ngari ar adal الموسمير مقدمال المجيء قوجيد أو مسرني مسوبري دي دول دولة أتياجيد فدلهم دنيل واسه سيل بدم نقل مايقال فاكسين إن مريا تايم إني أم مسوي سبتيارك ترى أبلور بلا ما ضروري أمروري كده واسه مقدر سيل بأكله سيا أقول قدم لا أتيالي أبو قدم مروري كده موصل بأكله مال سوم مسوي سب إن دقل الوانا تملي تيال بلو هلا وسبير إكزامبل وسبيريا Dr. Hancock si adro ase tial variant malu tial rakta Alsel sumang ngal nautra yela medidir tel utma ma oriamala en dit maute mal bogrur tel marana dil sumang mora abasiol oradim lam tengla ulringie edegims nga adekal sal sebel ngidre lal sel bla nga igal yobo en wa bla dik masitial oriamal matial utma mlamo meringiat mauta ngawring masya ule kada udul turga klil wase oi kada openera balwad matamaral merat dingin ay gel doru la ulan diri kamal mal malangari testing taiwan amalungul kada tester tir airport magdana sa laster te lire edi merbela li maktubsel mutan maral akwam ada tester tir with merul sigang ruera almei 5 days after almei di dalam tingna se maybe ngari tigil amersel bada tester tir sel lager del direct aye adon mol mal adjust and make sure abel wada sel baakla maradan ngara al sel asedan men mol ma yel gida yadan muru rabek al sils angal gida sin mora school arada sin mora stoa sin mora hospital sin mora muru la yel mora kamaldi muru la yel rugul activity ni require al sel aklang arti rabek al sils mong akari ma se kada mol mertial doruri agumaral wase gida amlar mula yel ngara led من مول من لو مس ريفيو ميك شور كده أصل بعقل دين سيادة من مول ما يقل أكتيفيتي اللورو من قدرني ترك اللورو رنگرا بلو إمال غريا إمور إكسامبل ديبير لو كمالونgi الإكسامبل واسه البيبي راتايم إن أجيريا دل الديكا دبيرة سمو دبتوك الأدل الباقلين sometimes إن ديوان الأدم مرة برتقل دي مودي قدوس بلور روغوي إنجيريا دل make sure ndekal san mo ar mun se drungil osenged lom dasu o mesel girela klungela belar rogir mar adar rogui le bebi ratamen ukti wan al ar kada malmo bul rogui mo kada emo madakta di kada ni tra kallo rang adra bulu e gida de gadi to kora di isa to ta se trelitian dultuira arsemmo mun kada maran meringa sulera bulu ramrigel de gadil البسكيتا يوبو نترجع expert CDC اللي يوبن جدرا ترجع بكل ساندي بكل لونيم لوري ويسي غفار الغرا كول لو مجلا ministry of health الغدم سادر بيلاو ما يجل دورو ات ريفيو امس سنغرا نكسل دورو من سي تيجدرا الدريغال ستوبرا والميرلا يدري انا ريال تلد تميل واي التايم التوبت سلموسو جد اللي واسر المر السلا مارش الدري قالوا مسير يدرا ولاسو لو مسير واسي ايغال بيبي رابلو المليا كريد ما بلو ادم وغرا رختري ngara igen moru le kami amongil sel bakle ngira adrablu mong gada agumra wasi adilla da melmol المرأة البدول سل الدوم دا سوريا بيبي راتم قد تيبل adjust راقوس nding ndi مرايل ndek am da sing ada kal gira del ukmal mobi to tetelu tendi tidak tahu tengale doktor yang ngira ite agumra lo ase amok te gargida ase aigal plan ergid ase da adjust ndek adi derelel ase ndit tiegi demro al sumung ase se ban namo de kal se tra control ergi ekada change the plan di adomrani el altama ase a plan ergid orior kadam adami de emertigal teru which means testing works mungkin moklorud ya sistem ergid orior marada alzheimer kita mau moklorud yang dengan se kadam mol masagal plan ergid tigang artikel masih ergid el mutra masasing ngarayget se adel sumok lu transmisi sudah.
Good afternoon, Mr. President, Dr. Yana, Dr. Hanka. My first question is for the President. School is open, and what about large gatherings like the night market, sports gathering, and funeral? Is that will that go on? And for Dr. Hanka and Dr. Yana, I think the concerns are for the unvaccinated individuals, including our children, the unvaccinated children. So how does the Delta variant will impact our children? And there has been a report that it has been children are impacted. So how can you explain that?
So First of all, thank you, Bernadette, for that question, and I think it's an important question. So yes, schools remain open, large gatherings can still happen, night market will continue, nothing changes. We believe there are imported cases, the cases are contained. We're fine, but we should always practice good measures, which includes mask wearing. So if you're in those large crowds or in enclosed spaces, wear a mask. It's not mandatory, but it's a good practice. So we encourage it. And I'll turn it now over to the experts.
You go ahead. The question about the
children.
kids and children.
Well, maybe you can say that in Palawan.
So, yeah.
What to do? Sel gira say mungkarawa school may gal muklod segad. Kadamal mol mo. Odis. Babes. Mlagira say kadam karay gal muklod on di bel marwa school. Ay gamal mol mal ngaring activity. Kadamal mol mal mora school. Mal mol mal mora kamal di. Mal mol mal murula gal activity wa night market. Liwa eli. Di ndire kalungil ada practice ay gal lungil practice eri de ba sel muklod segad el simra al sel ablay en mo masking malungil. Aya el help el sob aklaw. Mong sel to tell message ay gal botol el blol غفر blol masad el wasik gira mishu imad gira el distance ay gira the practice rabek time. Ya gumda sel tara blada subira adr bela ومالو يلا يجلو سيساق ميتيل دريغا دولو سيمو ماسك ميتيلو ماسك روكو يمكو مال مسودان لين سي اول اوتيلو سي كده غريق لا سواد السلبا كم سولا.
Yeah, thanks. So the question about protecting the unvaccinated, especially the kids, right? And so in Palau, yeah, those aged 12 and under are the only individuals that are not eligible for a vaccine yet. And yeah, that is kind of concerning, right? When you think, oh, okay, well, we've got people who are older that are vaccinated. But there's some things that can be done to protect that group. One of the most important things is making sure that if you are an adult who have kids, that you are vaccinated. And if anyone who's around kids that are 12 and over that can get vaccine, that they should get vaccinated. Because then that really helps limit the spread from adults to kids. And in through the history of the pandemic so far, now it's changing, but it looks like originally a lot of the transmission came not from kid to kid, but from adult to child. So if you are unvaccinated adult and you have kids, you want to protect your children, the first thing to do is make sure you get vaccinated. The other thing, we talked about the layered approach, so adding additional layers of prevention. One thing I'm sure parents are worried about is school. And so right now, again, to reemphasize that there's not community transmission, so that we know of, so that allows for schools to be open and those sort of things. But there's also things that can be done if there is more transmission that can help reduce that risk for kids, and that's mask wearing and those sort of things that Ministry of Health has plans for and are revising the plans as they adapt to the additional information. But the last thing is just to reemphasize why have we gone through all this pain of isolation and rolling out vaccines? It's all of it is to prevent the severe illness from COVID-19, the hospitalizations, and the death. And fortunately, although Delta variant does cause more infections across all age groups, and so therefore will cause more infections in those under 12, they still have extremely low rates of severe illness, hospitalization, and death. So that's another benefit that although kids are not vaccinated, the number one reason why we're vaccinating is to prevent that severe COVID, and it's very rare that they have that already. So that's a sort of one of the fortunate things that we have is we're dealing with COVID-19.
Mudlong ngal Dr. Hancock amalgok na se tara rolel ekada masabaak tirgal ngariar clear truma erung at tirgel maklol adl lob titrir lo ngalgartir amma yobo lesser lang yobo etabay sob klingal ngal ngaringa kora ewatlel mandabol ser direct malgok mlaseng delta asab elimur arbetoklat ndagdil makloma imur arbeklat age group nding dagal malgok mlaseng ser morangal ka dagal boligel maklol ser dagal bol new yingringi dagal bol ser madringi ngimul ngegrel ser di tararolel temos baakla at tirgal maklol adlo bobent lob tirgal ngal gamma yo bortir mung ndaglo liuringi letem lom tigl klase ndagal ngal loywili mora tarangal gra school ngara klol adl mora ngal
President Ungilita Silse, first question na nga kakti follow up persel karila Miss Raklay. Ang concern ra public alwase understand thersel omol gorangira sendi al close travel ra between Guam bela ka dos pairing mura school Michael for many other reasons. Aba I concern ra adangar sel 3 days still 72 hours lungwa testing was it they have the COVID or not segi del 3 days al bagi clearing was silsile de club sen by sub ila lungwa rakte ngul merbelaw ma question nga kasi kautel mlaw is was ka mo testem ra a day after segi del 3 days and digal digal sab directly si ila blur belaw at Chester segi del mutol ko da pangil mo itel do urung ira Taiwan mang instead ra by protect ra era ligir ra balur belaw stop airport
yang kontrol malung ilger kida ablura Taiwan mal le urula bangiet egot makli selo asika da testra al sel airport tru era ngasar askogi se urera Taiwan le Taiwan trigger ada walom ursel blura Taiwan rogui emerbela akoma tribal moda le ada ngara hawa el mel connector akwa ngara shaba le mel connector akwa igade batemin ngara akwa mamring ergi da tester tir akwa me edega testing capability akwa masa ula se tu amle urdas wa se tigi bla bla subi wa se bodo link intersel a mars Seleger der belaw, igada tester tir belaw. Kadamla prevented in 72 hours ahead. Di is an extra measure seleger der belaw, igada muter tester tir seleger. Isegida amo extra global masab akhrigit. So segida aktulit tora amrigila dangin.
Lakatakla. Next question nga ge to the medical expert for the two individuals who were tested positive for COVID-19. What's the science behind it? As I understand, they were vaccinated. Were they able to transmit COVID-19? And did we dodge a bullet on this one? We were just lucky that they did not transmit COVID-19, or is it that since they are vaccinated, they were not capable of transmitting the virus?
Yeah, excellent question. That's one of the changes that Delta has made us face. Is that previously it looked like the vaccines, if you were vaccinated, the chance that you got infected and then were able to spread it were extremely low. And if you recall, CDC said that if you're vaccinated in the U.S., you don't need to wear a mask. You're okay to do that. But the science is starting to show that perhaps for Delta, one, you have a slightly increased risk of getting the infection. and also potentially could spread it. So that's why CDC reinstituted mask policies across the U.S. And that's one of the reasons why Palau is also looking at, you guys had changed your testing so that you can identify folks earlier. We don't know for sure exactly if somebody who's vaccinated can spread it as easily as someone who's not vaccinated, if they're one of the unlucky ones that get it. But despite that, being vaccinated still provides you the most important protection, which is the vaccines, even against Delta, are very effective, supremely effective at preventing that serious illness, hospitalization, and death. And they do help prevent you from getting infected. So then, therefore, help reduce that. But the big thing is that the reduction in severe illness. So with these individuals, this is one of the reasons why the ministry had the testing at 5 days, is to try to identify, even though everyone's vaccinated, try to identify if there are some breakthrough cases, and being able to identify them and get them isolated before they spread it further in Palau. And so it looks like the system has worked this time, and it looks like the Ministry of Health has adapted the system a bit more to enhance that as well. But again, the protection level that the community has because of the vaccines against what we are most afraid of from COVID-19 is Palau's got the best vaccination rates in the world with the best vaccine. So you guys, that protection, that sort of COVID safe that you guys talked about is a really strong foundation that's really protecting you to an amazing degree.
Riter tirgal tirgal terung the quarantine al 10 days tirgal le close contact the quarantine al up the tirgal le close contact the ngarab la self quarantine ngara tirgal
sulang ragere ngarila tirgal case isolated tangara isolation al 10 days tirgal close contacts and milang self quarantine monitor the rabical seals and other surveillance and monitor tir girin metes tra day 3 ma day 10 so far ang tirger rogul close contacts direct kalgora dia symptoms tir o mesin der tiram lamrus mong direct kaltara added protection and ding say the self quarantine at tokol mortia sa hindi kalomais unless ang tamo siga o gurula adra ministry rahel melmol monitor tira bekal seals imrot tame test ra day 3 ma day 10 hindi tirigel positive case adi ngar isolation at 10 days imrot test ra day 10. So the question was quarantine arrangements for the close contacts and the isolation protocols for the positive cases. So again, the positive cases will remain in isolation at the Palau National Hospital for 10 days with a test on day 10. The close contacts tested negative on day 1. They are self-quarantining with restriction of movement requirement so that they shouldn't be out and about except to seek medical care and then come in for testing on day 10, day 3 and day 10. But I think so far all 26 remain asymptomatic, but the Ministry of Health surveillance team continues to monitor them daily with their situation.
Salam, Mr. Presidente. Mulway sa pungani tirgal terul positive COVID-19 and tela club segom sabiul momdet na sitiram la model Algeria tel na model positive ma kada taying artir en ngari akar lola itiragi COVID-19
Dr. Let's ask the question to Dr. Thane, Dr. Hancock. So the question, Dr. Hancock, is what's the appropriate number of days that we quarantine them and then release them? And then do we give them any medication, or what would be the appropriate?
Yeah, excellent question. So so far, CDC recommendations have for if somebody is infected with COVID-19, the current isolation recommendations are 10 days of isolation. So, is if individual isn't immunocompromised or has severe illness, they find that after 10 days they are no longer infectious, and so they can be released. There are a few individuals that if they are severely ill, let's say in the ICU in the hospital, they tend to extend it longer than 10 days. So it'd be 20 days. And really it's about, and you want to make sure that the person no longer has fever. For these cases, they're asymptomatic, meaning no symptoms, so it's 10 days. For quarantine, which is when somebody's been exposed and you want to keep them sort of sequestered away or away from others so that if they do turn positive, they don't spread it. That is also 10 days with the test is what CDC recommends. Sometimes there's even recommendations, CDC says, well, maybe 7 days with a test could be acceptable as well. But there's different sort of risk levels. So sometimes for CDC, because in a lot of states, there's just so much transmission. They can't do the full 10 days, and so they do the 7-day and test out. But 10 days is good with the test for quarantine. And Palau may be having something that's maybe a bit more conservative or in line with that.
And then medication.
Oh.
He's asking.
So for medication, in general, there's not really many medications for asymptomatic COVID in general to speed up the isolation period. But Palau does have access to several medications for COVID-19. Some are for severe illness. If somebody's in the hospital, there's medications that can be given to try to help them recover better. And then for individuals who have COVID-19, especially early in their diagnosis, who are high risk for severe illness. So again, I mentioned that our goal is to prevent that severe illness. One, the major tool is vaccination. There's also a infusion, and that's an IV infusion that can be given to people who are high risk, who are infected with COVID-19, and you give it to them before they need to go to the hospital. You give it to them just after they're diagnosed, if they're high risk for it, and that helps reduce the risk of them going to the hospital. It's sort of like an early treatment, and Palau has that, just received some new infusion, some of that medicine as well. Right now it's called RegenCove. And so that's another tool that Palau has to maintain its COVID-safe status and help protect its hospital and protect people from going into the hospital.
Some of the
Doctor.
Oy. Ger amlara Mr. Lamsuk ngaseng tirgal el smer ngar hospital ngaringa karol lolay ma Dr. Han Kaka diluk mong ngaringa karol rejem konklel el wa IV el dangal mastrir tirgal adel mosmer el high risk arwa sugal ma arwa makita hartertir asbed el dima mail mastrir ru era el lolgabartir men dagal bol close mer ma dagal bol New England ra hospital ma igen aringil blal ngai arwa abriter mangaringir hospital lo labar elang mangaringa igel go karol lo mastrir tirgel New England tirgel mal lamos mer mang قبل أولك مثلا ناريا أو الليبل التلاتارا وجرول أقول الليبل سال يوبو دير سكوم تيميتر سال مانت المرسل لونغيرون انديرك ناريا تلاتال الضم غرتير لو سبعي جايد اللوروس الديركم لورني ما أسبيتارا من ماي
Sula Mr. Gafare, Gel Director of Health Services Rabluram Rigela, Luaisak mo September 20, a cell booster vaccination na girin mo malaria adal. after 8 months itiagid el mother nam tal Pfizer amo weak maluben mo diagal effective. Kiden diag da take our risk al sumagat continue lod sisabra other akrel bela miso isur belawe e dirgago de hu seguir del vaccination al sum itiagid el fully vaccinated am lamo miitut.
Kalak ko bak pa sa Dr. Hancock malgora sumodi sa igid el tetele la talang tangil sa igid along edel dose malugong third shot e malko kukpo dosa dra kuk tetele la wasem magrabodoro sura abelaw. So the question, Dr. Hancock, is about the third dose and about the effectiveness of or the efficacy of the vaccine after 8 months. And who needs it at this moment, and is there any visibility into when everybody else would need that third dose? And if there's, can you also explain the difference between the third dose and a booster shot as well?
And the risk, if we don't have it, are we at more risk now that it's already 8 months in?
So the first third dose that has just come out, that you may know of, the additional dose recommended for anyone that's fully vaccinated with a mRNA vaccine, which is Pfizer or Moderna. That is for individuals who are moderately or severely immunocompromised, which means their immune systems, for whatever reason, whether it's special medications or a health condition like cancer, that it's not as strong as the average human. And so what they've found is that they need 3 doses to be able to get their immune system up to the level where it's good at protecting them against COVID-19. And so if you really look at how this extra dose is written, this third dose, they call it an additional dose, not a booster, because it's actually a third dose to get those people whose immune systems aren't that strong up to the level that they'd like it at. The booster shot is actually for when you've had someone who had a vaccination and they have a good immune system, they had appropriate coverage, but that strength of the immune system waned over time, and then you give a booster to bring it up again. They are, as you know, are looking into whether or not boosters are needed. They're looking at a wide variety of studies coming out from all over the world, and including in the U.S. And when I say they, it's FDA and CDC. And you've probably heard that the leadership of FDA and CDC, along with the White House, has come out and said, yes, it looks like we are moving towards approving boosters. It would be for folks 8 months out. And it's just another way to leverage that most important tool, which are vaccinations, to really help increase the strength of those vaccinations. Fortunately, in working with all of our jurisdictions across the islands, they have been preparing potentially for this booster rollout. We won't know exactly, till FDA and CDC have given that approval, but it does look like that may happen. Again, it's looking at 8 months. So 8 months, the people that were early vaccinated, they're just about at 8 months at September. So it looks like the timing is going to be good. And if you think about some of those early September early vaccinations that were rolled out here in Palau and across the U.S., they were very limited numbers, right? That was when we didn't have much vaccine. The pods that used to give out vaccination weren't very big. So we're confident that when that booster becomes available, Palau and many other places will be able to reopen their pods and be able to get those boosters to folks if they get approved and get them out quickly to add that extra level of protection.
Mr. Talam sindi soadal bol blaktakl mong Dr. Hancock milsada erul batangela yobo milsada se longe dei liobo el mortirgel lomgodok mut mitut immune system ertir immune system ra batangeda ay gelot ngakla ser mang tirgel mitut immune system ertir aw kata tirgel mala kurula cancer tirgel mlamora bone marrow transplant, tirgel malaba msisi steroid. Tirgel gidel adam ituta immune system tirmung selongedel lorus ongedel requirement ndakal booster. A booster ak ukmadal tokoy, a booster ak mlase tirgel adal diakal sera immune system na dingir. Ending mlamo koram ituut aigel lurerela yobo abodolisi irtil omstrirengel longedel duk booster. Mabol blakatakl mo CDC mlatabdi awdaswel mase tirgay gidel ituuta immune system irtira mo malar ongedey lorus. Ya booster mo riwlo. Dirga kabol blakatakla.
Ngil odosong mutiling ma Dr. Yano ma Dr. Hanggang kami doon mutakla kami mentong artiang. Timis ka gini mas kumiyakri kaila edin hong bumdita mo hensi. El al sugum tirgay del terung amlera sera Sunday last week sera Friday tamil tigretilo se to labay kan rak. A question o se elang temotelal adamelo barak. Kita se el masen namo dia kalsba ela artok tangar gidem hospital gidem lumar artigam ko store omra. Masugum ela tirgel ner eli mot test tira Friday eu mutik lo se terun tede mung segi lo se mut magrar elang at what point e ko store ngilo se kala store de tekrai kan se agotel ger ongerul ger ase ela tirgel el toktang marnurs em no mes trigal smer trigal terror la trige osisul time et mal mol lo mes trigal go baby ra patient tir et trigal mol test til wase dia lo singil mor trigal smer tam la mai karak mal bendia ya ongedel gera wase el trigal terum mal trigal go mamral mesois bro trigal tiro la terra se bi lo yu del mora arbe bidarat tirigel mlama orus ma alwes iloid el morar ad belau el mlama amrus seguida kita ke mo
pa mogel toram ya rigel mul
algo toker rakaum
okay. He mentioned 3 questions. One, these individuals who tested positive. The question is actually to the president. When do we close the border because of these 2 infections? Number 2 question is, those who took care of the 2 cases and now are seeing other patients, what happens to that scenario? And the third longedeng pulmongrang. Oh yeah, and then these 2 cases, can they transmit infection to others who are vaccinated?
So I think as far as closing the borders, I think, with these 2 positives, that would not be something that you need to do. Again, we're finding that the vaccines are especially effective at preventing that severe hospitalization and death, which is our number 1 worry, even with Delta variant. I think so, and I'll let President or others if they want to add more to it. The question about the hospital staff that are taking care of these patients is an excellent one. Initially, early on in the pandemic, there was worry that there was going to be a lot of spread from patients to the healthcare providers. But what we found is with appropriate PPE, knowing that these people are infected with COVID-19, it's actually very rare that a patient infects a healthcare provider. So these patients are in the isolation facilities in the hospital with the appropriate infection prevention control. So these healthcare providers are not considered close contacts because they're wearing the appropriate personal protective equipment to prevent their exposure. The other question about can the two cases spread it? So, fortunately, asymptomatic folks maybe don't spread it as often, but they can. And that's why the Ministry of Health has these folks isolated away from others so that their chance of spreading it, it's hard to really measure exactly how much somebody can spread the disease. And that's why if somebody's positive and a new positive and not a historical case, we recommend that isolation regardless based on it. So it's not that I can tell you how specifically infectious each one is, but they potentially could be, and that's why the Ministry of Health has isolated them appropriately.
Señor Presidente, lo de celos en televisión, middle story.
Beh, malo tila malungil ger. Mgotrule gira de lo mesra capacity hospital regit. Lo hacen tetela la da silo tagartir. O mesra lo hacen ngrasel risk el trigal adel tira amosmel el wal selectira severe. Seguida dobal malboda be decide lo hacen namo gira del shutdown kada magaran. Di sel domeso urma atleta sel domesra iloisra other belau maklungela vaccination rate belau ngade ka se the richer seguida point el wasen gira del magasimel len ndiga de sat la hospital gidel len alakla el mop toisra adel smel mosois bra al sel because kadam la vaccine seguida Trigal adre la le triga asymptomatic. So amarari de mal de qabul da tetrin mo hospital. Di tiawal first el geyser gid matangar hospital. Di triga ngasil el simra ablirir marubin hotel room tira de qabul tetrin hospital le triga de ser. I mean دقل سائل ولا غير كتير تدي بارقت إن دقل سام غرض ساد تختار يوم مسخر سلاش ندي تبارقت إن دقل سائل من بترجع سائل ما بتوخ هسا ندي سائل جيرة المغربين ترجع يد لو بارقت تمرال سمير متصبع يجيد سائل بول بتوخ ترجع يد تمرال جيد لما جالس مقدار كدار مسوم سري ندي sel dultiro ur mo omsu mai disira adre belam lama yo bortir en adegal selu klomesria doctor henka adega dengalak persegi del mo require se que del mosimana ele maybe ngase kala askari mo aiser sel tetela la kwamrela Dr. Hancock, I think it's important for you to share the number of hospitalized patients now in Guam versus what it was last year. Because the question is, so when are we going to shut down when there's too many cases? I said, well, first we have to be overrun at the hospital, but we're not, based on data, based on the size of the population that's been vaccinated, it's highly unlikely we'll ever have to shut down because we'll be overrun, right?
Right.
That's my understanding.
Yeah, and of course, I mean, you guys will adapt if there's different variants. But with the Delta variant in Guam, what we're finding is, you may have heard Guam, there's many cases in Guam. And when you look at the surge in Guam, it's almost a year ago that Guam went through its surge in the fall. That really was the biggest surge in Guam. And as they found cases in the community, they found that sure enough, the number of hospitalizations went up as well as the cases went up. And the peak at that point was 105 people admitted at one time in the hospital in Guam. And that was very difficult for the hospital to maintain, and they needed to get extra help and manage it. Now we're going through another surge. This Delta variant is very good at causing infection in unvaccinated individuals. So we're seeing many cases. But the number of people in the hospital in Guam right now is 20. So we're seeing that there's a much larger difference, right? That the number of people that are getting severe COVID is much lower thanks to the vaccines than last year. And so that's really why, if you look in Guam, they haven't really shut down like they did last year at the time, because the hospital still has some capacity there thanks to the vaccinations. And again, it's that primary thing. The vaccines are so good at preventing that severe illness, so it really helps prevent the need to shut down.
Sala, Mr. Presidente, tiala mura tirgala dara I ozil girela cell contact tracing. Homelgot masinganya 26 cell close contact blam tested negative. Ela cell flight el mira August 15 tirger rogul passengers em la cell ngarbela automor cell el 50 mo malara testing mal ube kom la start el modo du tire mo tested tir.
So tirigel mler August 15 rokui amne tester sera Friday. Tamle over erul darta ame tester sel silsa. Outra tirigel erul darta ma ode agumdas mle 200 toria me tester sel silsa. Tirigel teru amne paseti. So wal deja el mut el tester seguido el tester day 5 seguida wal play clear tir. So tirigel el tool el positiva mildang au ulmo mumleru la contact tracing hale qadi talib الموت السموديس el contact tracing so سيجد الملقى تقلع فار الواسع contact tracing close contacts tirigel هذا البنجيت tirigel السمير at least 6 feet هذا لونغلير المبذول نرى 15 minutes or more سيجد قنا definition close contact tirigel الملامدان ال 26 amla test maqadam la amla test negative okmong mlaringi ya one tirigel mle test positive and then naqadgu mle ngoriak mor tirigel secondary contacts tirigel ku contact ringel contact di al time sum tamle dim le negative rokui engwal wadim lor seiki di egu korastope mengila ku pesel let's say ngar bebirar madang al mle close contacts tirigel terul smera elang tirigel mutal mera testara onge del klebsei matamera klugo longeru lurior tel mutal test el mutal yegidel antigen ma yegidel el PCR tester klugo el sugum tadiga negative etamelo qadamal mol mluaseng disegidel circle ratigidel contacts to mesertir sugum ngaringa ku kwan el madang enen qadgu klumutal morsegidel walongeru daw ratigidel contacts tirigel contacts aldo makmalgol waiseng malbeto garado podong el mel el pekik leta wal qora contact tirigid el contact matirigid yabodo o mesertir unless tirigid el contacts awal bol positive ela selbon merek selongevel test selongevel klebsel test el walongerul test egadamngi el morsegid el tru el klebsel el goringal toktang lo sesegid el period they give you isolation period, malubeng quarantine period or contacts marsmera. They give milga taklilo sa CDC tadio isolated till 10 days and then al tester till. Hindi gida ko beyond say magada mo tester till selong ang otru club say. So tirgal terul smer, matirgal rogul contacts about the tester till ravaten. So kung the test negative and then ako the really certified from isolation ma quarantine. Also kung tamalmol mal positive, ekadal mutal extendra a period isolate malu with quarantine.
Bulgulak mo tirgel terung el sales kogira August 15 adimlak al transmit al raktel mo tirgel restra passengers.
Sab edel kumul waisay lakadam larong osirang kal adal wasay wala incubation period malubeng time el mo ultra adel sab edel tester ngil positive angara edel klebsay matira kamle e email klebsay at me test min sab edel qora safely sel wasay di seguid el time le email klebsay adel ngole la belgerda en bitirgay del terul adam le test el positive.
Gabo ulo rin.
Dr. Hancock, you mentioned that the incubation period for the Delta variant is 3 days. Is that correct?
Sorry, yeah. So that's the median.
Yeah,
So
the
that's the middle part. It can go longer, and that's why quarantine is longer than 3 days.
Yes. And for the other variants, it's more than that, more than 3 days.
So the median for other variants is about 5 days. Again, the long end period is that 10 to 14 day area. Yeah.
Okay, so my question is the approach that we're heading to, whereas we will test the passengers the day after they arrive. Is the testing will it be able to test whether a person is positive with COVID-19 if the incubation period is 3 days, 5 days? If they are tested just the day after they arrive, will the test be able to detect the virus?
Yeah, excellent question. And because Delta variant has that shorter median incubation period, it means that you can identify it quicker through a test after somebody's exposed. But we don't know when people have been exposed and when they might turn positive. And so there's no one test at like the perfect time that's going to catch everyone. And so that's why, I think your approach or Palau's approach makes sense, that you have an initial first test. So hopefully you weed out a certain portion of folks that then after they arrive, you do another test. So you're identifying people early once they're in Palau and in restriction of movement. And then you're doing that test at day 5. So each time, although none of them are perfect, by adding those up together, you have a fairly substantial reduction in the risk. But again, nothing is 100%, but it definitely makes an impact by adding those extra tests.
Just a second question, Mr. President. President.
Gabo.
Mlaring leadership meeting ra omira tel press conference understand the sa kuk sel tarabrancha ra government tamle soril stober tialo marael ngara tadilur kau mangara kuramle discuss ngara kuramle reaction tirel girel tial tirkal terul positive malukor tirkal ku prestra leadership kadat wasa kada malasam marurar adara balum dia kal salbagikle ya reality ngaringar adal kuramla panika ngaringa informational gimgilal wasa atras kurbelak medal 17 ngal gamle absent rel al sils mang tiogel wasen kuk ngaramle reaction sel restra leadership. Thank you.
Gotrula meeting rel alsil sa kumara laseng manle productive emlonete eler arbek leadership logeragir senators, delegates, governors, tirgerugul narsel sorry logeragir amnete logeragir mora Dr. Hancock ama kosa gira ite gim narsel longera rogul ger magunda seng loblatak kadirgal Akmadayula saying Kloa Sebakrengar parents, and we understand or say the Sebakrengar Adam Adil Lop the Triangle Gilmore School saying Lel Bolmutia Rakta. Yesem Loblatakling Malne Kloa Nomle op toys are other absentra a school and seals. But Tokortira Amiri Yidel was saying Narakal Mokmur al seals. Mong kumoral wase amokte kara meeting rela masem meeting lang ila leadership am katakrin wase kidel other bela selba akla tadam la vaccinate yesil gotel important el message el all mulgoni Dr. Henga wase alsumun samul sob aklang algem make sure you get vaccinated. There is no excuse. Ketika rumang algem go get vaccinated. Saya gotel klol nges ul se adruli diragal Seldom urtial ngara lengar leather rogui. Mitrigil ngaliya ngara ikra lablur bela alme ukme olding rigid. Ome mo mask em gargik omrole me elakam dimo mais. Maise. Ayega ngiria del mot nakal imol blue kay ngasew hindi regal mlo bla katak rela mat regal doctor hen kam nam katakli al sumutri del ngal ngara 12 0 to 12 ang warakt hindi kan misisi wal hindi kan more severe mild atol speria mild or asymptomatic ay kita ado ngay mong giren mo salba akran dia adam adilem dengan sekarang kan masih in more school and they'll be safe al suo mong tabagik en malungin halol amaska hindi kan help protection ako na se tukol school am la implement ro ser sense o mask hindi kan prevent the spread mo na kundi kadire mo encourage us rogol sensei must be vaccinated sensei se dongi resel final approval ra se do mo asing clearance ra FDA giret tial el vaccine and ayudan more seguid el level wase consumo ka sensei girem no tia vaccination card pero adang se al next level ra osis akling why gelo lo ro la kabana komre lang al sumde ko ba vaccine card de kasi mortia de kasi morse nga gire la bela mon morse gidal el point ending the perimeter towards the final clearance ra FDA which we hope it's going to come this next month igida na mo se murtilo se igida a requirement ndi ti dado dongali ako tium etul pasen tra adre bela maklolat amlang o ayobo malimisan makasala ada diri kan ayobo ndi diri kan encourage ti la se bom ngu leng al saun masabak rangal ka ese abestel se emrulil ngar alem di kal dil borka ngar alem al mora atrigal ngi karel ngal gedal gida patigar ngu derti so sula among Bernadette.
Mr. President, you talked about getting vaccinated, and vaccination is not mandatory, I understand. So how would you encourage those 18% to get vaccinated? I know they are included with them is the under 12 years old. And Dr. Dane, when can we expect a vaccine for the 12 and under? And there are travelers from Taiwan that fly in, that come in Palau that are vaccinated, are not vaccinated. So how effective is it for them when they receive the vaccine upon arrival? I mean, when does the effectiveness of the vaccine kicks in? Thank you.
Okay.
I'll go first.
Yeah,
Okay.
go ahead.
Yeah, so unfortunately, the vaccines take a few days before they really start to prevent COVID-19. And so vaccines can't be used as a prophylaxis, but at least getting somebody vaccinated. So anyone that is in Palau that's not vaccinated, you want to get them vaccinated. And so even though they may come in and they're visitors, they're in Palau unvaccinated, it's in the best interest of your community to get those folks vaccinated. And then as far as when can we expect a vaccine for those 12 and under, I wish I could give you the answer. But unfortunately, we don't know yet. I know that there's efforts to look at these vaccines in these younger age groups, but at this time there's no certain point that we can expect those.
So first of all, the Palau community has been outstanding in getting vaccinated. The adults that are eligible, we know about 99% have been vaccinated. Of the 12 to 18-year-olds, by far we're well over 70%, right? 80% of them have been vaccinated. So, and there's more still lining up to being vaccinated. So, all we can say is we've done a great job. There's a few out there. We encourage them to come and get vaccinated. And hopefully, eventually, there'll be the vaccine for the 0 to 12. But for now, we just wait. And I think the initial estimates were some early next year, right? That's what I've seen. It could be later.
Potentially, yeah.
Yeah,
It's hard
but
to say.
It's hard to say.
Maldi the last question nga kay President mang kora ngara kora word that Taiwan to kora Taiwan algidel tal sterile corridor kita metara kora concern tira te gidel basing masibling mo niya sera blulaw ngaya kora indication wasita mo change sa protocol algidel at talo maralme alo mosto bal ubeng malumol maleng ngara kora processor say
Diyan maral mle sobo karumut sira gotera bodo ngi mandim na sig del time kado kay sira ambassador Taiwan mulo ay sira Taiwan CEC matamal el understand mle sorin mo daya detail el wase tirgat tamlar gel me milgram kado mil stira gel gol information matamna sang imported case mandim la sarudera afternoon at tamal gol menos india dimal mol leng Radra Taiwan amal betul imported case til direct. Yang penting lo say ngidim nguem container ngiem controller ngien you should be okay. Mong kada ngani amlo do sada say tla mosto balu tiak mal mongile algoritmo mas el umbrella flight. You'll be okay. Sula.
Mr. Presidente, tira para las tumlara Palawi Radio.
Good afternoon. Good afternoon. My name's Irene, and I'm here with Palau Wave, with the SWAL program, which is an open platform for the people of Palau. I'd like to acknowledge the Lady Doctor and Mr. President, Dr. Haley Cash. Thank you, and thank you, Dr. Hancock. Thank you, Kafar, my classmate nga karariter. Maldi, there's tang ay garik. There's tang andi ka atrablu e presidenta oldur matawase elak man nga sularitel no ngils mo diesel contact tracing et ilul dire kal tokor bela mo rahmal mo blakatak la dil asel ko ngeru asel gerel tele restricted restriction of movement masel garira atrablu ase Katawasan nga ringi, laptop ta press release, immediate release, may kalbato kalbabiel komuldurok, klar atrakapilment. And the tanggal mal mangkare enforce sa saigang, lang nga ringi tirigel ko rahmal diol tirak na silang nga matamiw mamatamam. Hindi sila kito ko di oli taigal, restricted movement. Melang nga ringi atarapalu, President yang atira kan mereng asulela kuk minister mutu le kama makora mong atatu.
Hindi ka rin sel force ruk mo merga tapos next.
Mal diungil.
Okay. So kakpa pasat ela kafar.
Sulang Irene raw daswal. Man marat to koy so kad manangil was sera au era boringa gat tablol gay sa kadumil sa mask. Direct kalimla kal salbato kar adal merde oltirak karsegi de longit mang el time material mler el alsil sangaria mitigation orders ang ilay si alsa niya director of public health del man makataklilo segel lugot talayim el klabsera selemay engiril mga sadra bisir ma umrolir al salabalu aldi mo igel niya orud el girin mo kun si irar adal mo si il morabang si iril morastawang al mo maarakalir si irin mo raigel siobay mapasyol niya certified ra ABOT ma PVA say gidi
Hindi ka lungil albora school hindi ka albora school
hindi ka namadangil no se umasindra ngal kalmeya adirga kal nga orus so hindi ka albora school
hindi ka albora kamaldil
hindi ka albora igigid no kora moklolondi bulwa kamandil may gelesya anait marget until atungusel day 5 test say giti sel tokora pulis of course hindi kal sabela ministry ra health tuwa del mo mangara erul datel adra bekkel seals make sure hindi kal magi direct lo langit ra adra bulul wase pomol ng sir kamamal lomaklat el suguma ada mal kora dia kal tirak dia kal mukarew eng sa el mutaw trala le sige mitigation order amal mo katakilo se asugum mo koi taygagi del ngatayagi del order and sabi mo taw trala mang ngariya process el iblam got maklaim ar adra Ministry of Justice el sabi el lot tutukla adal sugum nguli taygagi del ngar sige the mitigation order luli mukra testing mal sum ta dekalo ordering sa man dekal velo larsel day 5 malubin day 1 sa edro tutakliran la makadornis adornit tra adra blue sa takay ngisew o masindra adal me adili adat other belaw mong sugum ka madang la adam lo sindir gamlay
Akli.
akli yal sugum hindi takang emot tutaklin mer ka
Mela sige del hotline kami wasab edel diregal ngaray kal media he melokora atal wasen sab il call the hotline al sum komestrer atal dakalol tirak partial restricted movement te ngo sisul dengwal ngaray kay kitel press release
Dire kolikte lise kafara ngari sel ngeso dolari ngaradio ai madire kal HHS el mo help yidel rulia sel contact tracing logia dengwa mong seguida mara la urol yirel so hopefully by end ra yirem na mo urol sea goler yid diga kadam nasmiga udo kadamo 3.6 million aral sel system di kadamo mokor seguida part of the effort to keeping us safe no
Suman masaurat til ang president til Europe amlang mo opatil ay gid den dire kal dekal balkula ko kal ngaring yalla et tirgel buktar stal dekal tirak lel lorurar bebil mo mata
I see
Mela ka more say el cook restricted movement at poratokora by as of Wednesday, August 18th. And 154 companies in Palau have been pandemic certified safe for you. Masaygit yaw ngil to ko, elang nga ma-minister mo to all at adu ay kalkit. Hindi elang selso ko makuk by at yakal register the member of Palau Chamber of Commerce. Mandiya gibsan matangali en gukti akal sa pamil ko rakay nga sew monitor ay gaygi tagim encourage certir mo pandemic certified. Makora dioger tial gukarila atarabulul sa ikal stoang. Tabato kara adal matutura ikal stoang rapita mabitang surang al super center ma WCTC adal orer al tato mask kandir adal matutura al selar bebilen tiaklo mask. Emom tokora to orbitara kiaser tangarangaran malkay waged et yakar atal mal matingel waseng ganguk ta aldir kam larak pamel may alubang ganguk larigel may meseng kadal am kararingi
ka malungil concern di so adal muktel maringa sulir adal abalu masyobail again dir ka kura mandate to lo sebom enforce at tukura mask ma bebira restrictions sabay ditirin la akutmok lagi mong multoy ra situation na time mong adagi multob dara mandate hindi ka marover shobal dingil nasa adal lumdaswing ngirel matmok ra mungarakel sobokli and sabil malukol yalla kalo o tirak lang sabihin refuse a service mong again katambre nga sulir at rabalu makakrosyo siyoban na detail na tega initiative mong katawan mo tal yolingit ra aklay nga sew ma support at rabalu lo sa mem na kay nga sew mutmuk or sige laldo sa da mask hindi ka tutalala ada mandate ta mask ya ada lo mask luwasay malubong wasay it's either you're wearing a mask properly or don't wear it. Mang sige da direct lo ngitring lo sel so makamura sto ang mesa adni dil adal al okya kamal cashier mangaral ko di dargak lo tetelo mask direct kal mo ning sel reminding lo sitila lo moruring ya kal defeat the purpose of mask mong ngungil time the practice God forbid al bonia community transmission el ba algira man mandate already kada madu am tangalit talitan so ang sige na dadyo nitra koloring ra atrabalu ma support ma assistance ra gay gid rogul doru
dire ka dipok lilo sing area training al bolkan doctoring August 26 Thursday at 4 o'clock el pandemic safety training el Moria Civic Center mo kada encourage te gid el tokol shoba businesses el maybe the member chamber please ebo oje
8
ah diblo yes ngamura itra tutan mo forra kabsingi son tal sales Civic Center Sulang.
Bay poktulit to karam rigel. Thank you
Oh.
so much, Kafar.
I see.
And for demonstrating also how to wear a mask. That's important because people who are not members of our organizations, we have no say. So since it's not mandatory, then I'm glad to know there will be a training. So the training is going to be this Thursday
Mm-hmm.
at the Civic Center. From what time to what time?
8 to 4.
From 8 a.m. to 4 p.m. So all businesses who are listening right now, this live conference, whether you're a chamber member or not, please go through that training. So do it for everyone.
Yeah.
And it's, of course, free of charge.
I see.
So that's good. So my last is, actually, I just want to acknowledge Dr. Yanoy, President Alela COVID. He did a very nice video about chewing betel nut and how to be sanitary, health-wise, hygiene. And I asked him today, earlier before we started, if there's any possibility that the media could play that again for the public. And I'm saying this in English for the doctors here. I'm sure you've noticed that some of us do chew betel nut. And I'm one of those who's still praying that someday it will not be in our hospitals anymore. So I'm being honest.
I see.
Okay, my last question is, what are the side effects of these vaccines? Ngaray gal ko koratal malele, toktang le ngaringa, ikal rokul kal tola koratil ang ngaringa ko bungaringi,
Yeah.
pamsulang.
Adverse reactions. Why don't you, yeah.
Yeah, great question. So these vaccines have been given in the U.S. now, that includes Palau's numbers, it's over 169 million people have been given these vaccines. And during this rollout, there's been more monitoring of the rollout of these vaccines than any other vaccine campaign in history. And what we found from this so far is that these vaccines are amazingly safe. But there are side effects, and side effects are expected reactions that some people have when they get the vaccine. And these are reactions or symptoms that the individual can feel as their immune system learns how to fight against that virus by the training that the vaccine is having the immune system do. And so the most common of those are fever, headache, feeling tired, pain at the injection site. And so they find that these symptoms can last for a day, 2 days, for some people very rarely 3 days, but then people feel better and don't have any adverse or long-term consequences of that. And of course, individuals can take like ibuprofen or Tylenol, acetaminophen to help with those symptoms if they do experience it. Not everyone has those symptoms, and if you don't have those symptoms, it doesn't mean your body didn't respond well to the vaccine. It's just some people have it more than others. The things that we're really monitoring for with the vaccines are adverse reactions. So if there are any conditions that occur more frequently in people who are vaccinated that are higher risk. And you guys may have heard that even though these vaccines are extremely safe, they have identified some conditions that can occur extremely rarely, but do seem to occur slightly more frequently in people who are vaccinated than those that aren't. And so one was with Johnson & Johnson, the Janssen vaccine. There was the increased risk of clotting that was identified. That was one of the reasons why you may have heard it was placed on hold while they evaluated it. And upon evaluation, they found that this is extremely rare. They found that some people were at higher risk, so younger women. And so people are more, they asked people to be on the lookout for it, but it's so rare that they felt that the benefit of the vaccine way outweighs any risk. The other ones that you may have heard more recently is myocarditis, which is inflammation of the heart, temporary, that can be associated with the mRNA vaccines, especially tends to be in individuals or younger individuals when they're vaccinated. Now, this is temporary and has recovered. They're monitoring it and they'll continue to look at it. But when you look at the risk of Delta virus or Delta variant of the SARS-CoV-2 virus, that infection versus the really, really small, it's on the order of like tens per million people who have received the vaccine that get it. That when you look at that risk benefit, it's much more beneficial to have the protection of that vaccine than any small risk of that myocarditis. And in fact, they're finding that for individuals that have COVID-19, the actual virus itself, they actually have, it looks like they may have much higher rates of myocarditis than any of the individuals who are vaccinated. So again, when you weigh the risk benefits of a really extremely rare thing that may happen to only a few people from the vaccine versus what COVID-19 can do, the benefits of the vaccines are way outweigh any risk. But we continue to monitor, and just to reemphasize, in the rollout of vaccines, these are some of the safest vaccines. They're tremendously safe and very effective at preventing that severe illness, hospitalization, and death.
Zongil Irene, clear, eh?
Kadamla ngalak rule sigang. Ang dasang alam mo sa edel molungul ma Wednesday adan diwile di drutel mal di mrenga sulir arbekla fa tara blada subira ay gan meeting era chills sing sedel mo improve the communication ma iosia active lang magafara mo lao ay sa mo bekal chills lol to dara ukka brief summary so everybody is up to date. Legum das will communication aru tira adam mo daga tasal ba aklarandire mo ala laklarandire unda kalsal so bagarandire engal tegal terut taktang amage de rule sunday matuman mo naman mitra matira yagal ka grocery agency ma NEC rak klugu diregal help and make sure a plan ergida mo rather refine the rule man mo address again rogul ya possible albang leather future para di mga suli el samarial o toda ais el morablu e ono se orgida tial ngara ledel el lo ais el adrablu ay rogul ya albang leather o mal sulang ya dia sura makal tangat rol mal mal tangat rablu belau makal tangat ergida rogul o mal sulang